Hello everyone, my name is Yuling, come from East China Normal University. On behalf of the whole research team, now I will present our paper named Technology-Mediated Non-pharmacological Intervention for Dementia, Needs for and Challenge in Professional, Personalized, and Multi-Stakeholder Collaborative Intervention. Our author includes myself, Yuling Sun from East China Normal University, as well as Zhennan Yi from Beijing Normal University, Dr. Xiaojuan Ma from Hong Kong University of Science and Technology, JUNYAN from East China Normal University, and Dr. Tong from Kunshan University. As we all know that dementia is a very serious and common health issue, especially among older adults. It is not a specific disease, but rather a general term for the impaired ability to remember, think, or make decisions. And currently, dementia has affected a significant number of people worldwide. According to the World Health Organization, more than 55 million people are suffering dementia. And it also has been the seventh leading cause of death and one of the major causes of disability and dependency among older adults globally. And the cost for caregiving dementia is also very high. It is estimated to be 2.8 trillion in 2013. As for how to treatment dementia, currently also there are some pharmacological treatment methods, but often facing severe adverse effect and high cost. Instead, non-pharmacological intervention methods, also named NPI, has been widely used as an alternative treatment for people with dementia due to its safe nature, fewer side effects, and the potential to improve PWD's function, independence, and quality of life. In recent human-computer interaction, designing and using technology to support NPI has drawn significant attention, with the potential promise of supporting more enjoyable and meaningful NPI activities. Researchers have designed and examined different kinds of NPI technology, and this slide shows some technology which has been designed and used. While study has provided worth expecting vision for technology-mediated NPI, most of existing technology are still in the prototype design, involving brief testing for short time rather than applying them in the real world. In particular, during the practical NPI, the practitioner is the most important rules, but compare the abundance of PWD-oriented analysis and examination issues related to how NPI practitioner experience and pursue technology-mediated NPI has largely under-investigated. And in this paper, we fill this gap by gaining an in-depth and empirical understanding of technology-mediated NPI, in particular from the perspective of NPI practitioners. We hope to understand their practical experience and perception to technology-mediated NPI. To investigate our research question, we conduct a multi-phase qualitative study, including the observation of semi-structured interview. We begin with the observation of 5 in-person NPI activities with the purpose of obtaining first-hand insight into NPI practice. This table shows the detail of observed 5 activities. They cover different therapy types. The duration of each activity was about 40 minutes. And here are some pictures of these activities. After the observation of these 5 activities, we identify the general NPI procedure, the content, the workflow, the engaged people, and their collaboration, interaction, and communication, as well as technology and materials they have used. And then for deeply understanding practitioners' experience and perception to technology-mediated NPI, we conducted a semi-structured interview with 16 NPI practitioners, including 11 therapists and 5 caregivers. The reason we interviewed these 2 roles was that there are 2 primary practitioners involved in the practitioner NPI based on our prior observation. And through the observation, we found that the technology used in practical NPI was very limited, and to better stimulate interviewees thinking about technology-mediated NPI, we prompt them through several existing technology design to support NPIs and listed in this table. Our findings are organized from the following 4 aspects. And firstly, we will present the practical activities of NPI, and then we present the challenge of adopting technology into practical MPI, as well as practitioners' expectation to technology-mediated MPI in the future. Now, the first part, the activity and existing use technology in practical NTI. According to our observation and the conversation with practitioners, the workflow of practical NPI including 4 main stages. They are initial assessment, pre-intervention planning and preparation, NPI execution, and post-intervention evaluation. And this picture shows the 4-stage workflow. As for the technology our participant has used, our findings suggest the existing use of technology in practical NPI was very limited. In the 5 NPI activity we observed, the intervention process primarily rely on the traditional materials such as the printed paper of the old object. And the only technology in the observed NPI activities are a projector for displaying image, as shown in the last picture of in this slide. And then we ask our participants about why and how they perceive existing NPI technology. They share us a series of challenges they consider as the reason of limited use of technology. We now elaborate on this challenge. And firstly is a challenge for PWD to adopting and engaging in technology-mediated NPI. Our participants suggest that NPI's adoption and engagement are the most crucial part that directly impact the practical effectiveness of technology-mediated NPI. However, for the older people with dementia, their adoption and use of technology were incredibly complex and situated, which challenged the practical effectiveness. As one caregiver says that this older individual won't actively engage or exercise these technologies. They lack that awareness. If you put it on them, they won't feel very fresh or very enjoyable. Instead, they might even be afraid. Meanwhile, establishing trust with NPI technology was also a significant challenge reported by our participants. They think that it's very difficult for older people with dementia to establish the emotional connection with this technology, which in turn affects the adoption and engagement in the intervention technology. And the third challenge is the potential risk when adopting technology to mediate NPI for PWD. Most of our participants run PWD safety as the first thing when they consider adopting any intervention technology. They express that the concern about potential safety issue PWD would face if technology were applied to the intervention workflow. For instance, for VR technology, many of our participants express a concern about putting PWD into the VR context would cause safety issues such as falling down or mental disorder and so on, especially for those with high blood pressure level. And besides the challenge for PWD to adopting and engaging in technology-mediated NPI, the other kind of challenge is the impact. The other kind of challenge that impact practitioner usability and effectiveness of technology is their ability in supporting professional, personalized, and situated multi-stakeholder collaborative NPI. And firstly, our participants suggest that practical NPI is a high professional process, requiring very comprehensive and professional knowledge. However, in their opinion, the majority of intervention technology we probed was focusing on developing new game of new mobile application, but lack of the in-depth understanding to the professional procedure. As a result, this technology was completely incapable of supporting professional NPI. Most of our participants consider existing intervention technologies as more like an entertaining game. And second, our participants suggest that the practical NPI was not a fixed process involving a single intervention method. Instead, it is very flexible, situated, and multi-therapies combined, which challenge the practical effectiveness of existing technology which only involve one kind of intervention methods. As one of our therapists said, during the practical intervention, they make a judgment based on the physical and emotional response. And if the frequency is very high, they will reduce it. If the difficulty is too low, they will increase it. However, when it comes to the machine, how can the machine achieve this observation and a judgment? And third, as most of existing technology were designed towards supporting MPI for people with cost-gained cognitive level, our participants suggest this kind of design methods cannot work very well in the practical MPI scenario because in practice, each people with dementia is unique. And this significant challenge the practical utility and effectiveness of existing technology with cost-gained cognitive level. And fourth, in practical MPI, multi-stakeholders were involved, including the therapist, the caregiver, the nurse, the doctor, the family, and so on. Different stakeholders play different roles. However, current technology has largely overlooked this characteristic, which makes it challenging to have a very meaningful impact in practical MPI scenario. And the last one is that our participants emphasize the MPI targeting PWD needed to be care centers, put PWD in the center of making decisions or preparing detailed plan for intervention contents. But the technology or the machine often lack warmth and are incapable of establishing trust and emotional connection with people with dementia. Besides the challenge, our participants also expressed their expectation to future technology. Now I will present what kind of expectation our participants have told. And firstly, our participants expect technology could support the MPI practitioners' learning and training process. Based on our participants, currently there are very limited MPI practitioners which couldn't meet the increasing demand of caregiving for the people with dementia. They hope that more stakeholders can learn the basic MPI knowledge and then conduct the MPI in their workplace or at home. However, due to the complex nature of MPI, traditional learning and training methods often struggle to be effective. They therefore hope to use more realistic and immersive technology to assist the MPI practitioners' learning and training process. And the second expectation is to provide semi-immersive sense and rich material for supporting MPI. According to our participant, the higher modality and the richer immersion the intervention could offer, the better outcome therapy could be. But in practice, therapists also have limited time to prepare enough material to support the practical MPI. Therefore, they hope technology can help support this process and creating some immersive context for improving the outcome of practical MPI. And the third expectation expressed by our participant is assisting in evaluating PWD status and changes. Our participants expressed that they made extremely challenge in evaluating PWD's real-time response, but this real-time response is very important to the intervention process. They therefore expected to have some form of technology that could support the post-intervention assessment. And that's all funding of our study. Join on this funding, we discuss the possible design implication for the future technology. And first, our funding suggests that the practical MPI is a very professional and personalized process, but existing technology couldn't support this kind of personalized intervention very well. We therefore suggest the future HCI and related community to explore the way in supporting individual level customization from the content and the interaction aspect. And secondly, we also suggest future HCI research and designer to incorporate professional practitioners in their design and research process and consider them as one of the important end users of technologies. And third, we also suggest the future technology should carefully consider the collaborative dynamic of multi-stakeholder within the complex caregiving and intervention ecosystem. And that's all for my presentation. And we thank Shanghai Aizhaohu who provides the research context for us, and thanks all participants' support to our study. Please feel free to reach out to me if you have any questions, comments, or suggestions to our study. Thank you.